In this debate, Simona and Mihai discuss whether everyone should have access to good healthcare. Simona believes that everyone, no matter where they live or how much money they have, should be able to see a doctor when they're sick. She thinks it's important to start helping people, even if it's just a little bit at a time. Mihai, however, thinks it's not that easy. He points out that some countries don't have enough money or resources for healthcare. He believes we need to be realistic and work on improving healthcare step by step. Mihai emphasizes that making big changes can be hard and can take time. So let's listen to what Simona and Mihai have to say and think about how we can work towards making healthcare better for everyone.
Welcome, friends. Here is what I think. In a perfect world, everyone everywhere would have access to good doctors and hospitals, no matter what country they live in or how much money their family has. This shouldn't depend on how rich or poor a country or a family is. We're all people, and if we see someone who's sick, we naturally want to help them get better. Imagine if you or someone you love got really sick, but there was no doctor to help. That would be scary and unfair. Everyone deserves a chance to get healthy again, no matter where they live or how much money they have. We all care about each other. When we see someone hurting, we want to help, even if the person is a total stranger. We should all work together to make sure no one has to be sick without getting help, because in the end, we're all just people who want to be healthy and happy.
Hi everyone. Simona, I get what you're saying, but it's just not that simple. The idea of everyone having access to good doctors and hospitals is nice, but it's not realistic. Different countries have different resources and challenges. Some places don't even have enough money to build hospitals or train doctors. Also, the world isn't fair, and we can't just make it fair by wishing it to be. There are always going to be rich and poor countries, and we can't change that overnight. We have to work with what we have and try to improve things step by step. It's good to care about others, but we also have to be practical. We can't help everyone, and trying to do so can sometimes make things worse. We need to focus on what we can realistically achieve and build from there.
The reduction of suffering is something everyone wants, no matter where they are from. If you ask anyone, they will tell you they want to help others feel better and be happy. It's a basic human feeling to want to reduce pain and suffering in the world. Throughout history, people have even fought wars to try to stop suffering and bring about a better world. They believed in this so strongly that they were willing to make huge sacrifices. If so many people agree on this, then it shows how important it is to all of us. So Mihai, if everyone agrees that reducing suffering is so important, why do you think it's impossible? If we all want the same thing, shouldn't we be able to work together to make it happen? It seems like something we should be able to achieve if we all put our hearts and minds to it.
I understand, Simona, that reducing suffering is something everyone wants, but wanting something and making it happen are two different things. Even with the best intentions, there are many obstacles that make it really hard to achieve this goal. First, not everyone agrees on how to reduce suffering. Different people and countries have different ideas about what needs to be done and how to do it. This disagreement can make it hard to work together and find solutions that everyone supports. Second, there are limited resources. Even if we all agree that reducing suffering is important, we still have to figure out how to pay for it and make it happen. This often means making tough choices about where to spend money and how to prioritize different needs. Finally, there are political and social challenges. Some leaders and governments might not be willing to cooperate or may have their own agendas. This can slow down progress and make it difficult to implement the changes needed to truly reduce suffering on a global scale. So, while it's a great goal, achieving it is much more complicated than just agreeing that we want it. And also, if I may, even if we come up with a perfect system that could make everyone happy and everyone agrees on it, we can't make it happen instantly everywhere. Transforming the world takes time and can't be done all at once. Implementing this system gradually means some people will benefit earlier, while others will have to wait a long time. This could create a lot of problems. People who get help late might feel left out and become suspicious of the process. This delay can cause unrest and make people unhappy. even if the final goal is good. They might think it's unfair that others are getting help first, and this could lead to conflicts and make it harder to keep everyone working together towards the same goal. So even with the best plan, there are real challenges in making it happen smoothly and fairly.
I get what you're saying, Mihai. But even if change can't happen all at once, it doesn't mean we shouldn't try. Starting somewhere is better than not doing anything at all. If we begin helping people, even gradually, we are still reducing suffering little by little. Yes, some might benefit sooner than others, but we can find ways to make the process fairer. We can prioritize the most vulnerable or those in the greatest need first. By showing that the system works and bringing real improvements, we can build trust and encourage others to support the changes. And about the unrest and suspicion, communication is key. If people understand that everyone will eventually benefit and that the process is fair and transparent, they are more likely to be patient and supportive. We need to focus on the positive impact and keep reminding everyone that we're all working towards a better future for everyone, step by step. Also, if all the people agree to work toward that goal, the improvements will arrive soon and at a fast pace. When everyone is on the same page and working together, things get done much faster.
Let's look at some examples to understand the complexity. Take healthcare systems in rich countries like the United States. Even there, not everyone has access to healthcare. If a wealthy country struggles with this, imagine the challenges poorer countries face. Another example is education. Many countries agree that everyone should have access to quality education. But in reality, there are still millions of children who can't go to school. Despite global efforts, the issue persists due to lack of resources, infrastructure, and sometimes political will. And let's not forget natural disasters. When a country is hit by an earthquake or a hurricane, international aid often pours in. But coordinating this aid and ensuring it reaches those in need is incredibly challenging. There are always logistical problems, and some people might not get the help they need in time. These examples show that even with good intentions and efforts, achieving fairness and equal access is extremely difficult. We need to be realistic about the obstacles and work on practical solutions that take these challenges into account.
The goal is to make everyone work towards universal free healthcare. We can encourage both countries and individuals to improve, while also addressing corruption and abuse. For instance, we could offer financial incentives or rewards to countries that make significant progress in providing free healthcare to their citizens. This way, even poorer countries would have a reason to invest in healthcare, knowing they'll get help and support in return. On a smaller scale, we could encourage individuals to contribute by offering benefits like tax breaks or subsidies for those who volunteer or donate to healthcare initiatives. This would make more people willing to get involved and support the cause.
We are now at the final statements of today's debate. This discussion is just the beginning, as we will continue exploring these important topics in Part 2. Let's hear the closing remarks from Mihai and Simona.
We must remember the importance of practicality. Achieving universal healthcare is a complex challenge that requires careful planning and realistic approaches. By looking at real-world examples, we can understand the difficulties and work towards practical solutions. It's essential to address the obstacles and ensure that our efforts are sustainable and effective in the long run.
We can't let challenges stop us from trying to make a difference. By using incentives and addressing issues like corruption, we can motivate both countries and individuals to work towards universal healthcare. Starting somewhere, even with small steps, is better than doing nothing. Together, we can create positive change and move closer to a fairer world for everyone.